put it on the table and think, okay, I did that. Okay, I get that one thing done. And then realizing as healthcare professionals, we realize that, wait a minute, what else can we do to help our patients realize that connection between food and health and healing? And it's just amazing to me. If you look at all the chronic diseases that are associated with food insecurity, there's diabetes, cardiovascular disease, stroke, arthritis, kidney disease, obesity. And I do a lot of work in obesity, and people go, Tori, wait a minute. If people don't have access to food, how can they have obesity? It's very clear. If you don't have access to food and you have food in front of you, you may overeat, or you may not necessarily have access to all the healthy foods, which actually make you feel fuller, and you may eat the unhealthy foods. So when you don't have access to healthy food, you have an increased opportunity to get ill and to have these chronic diseases. But you flip it, and that's what Good Shepherd's doing. If you flip it, and we actually increase access to healthy food for all Mainers, but especially Mainers who have food insecurity, you can start to see that their health gets better. There's been some amazing studies and some work that we're doing right now at Maine Medical Center where patients come into our hospital, and if they have congestive heart failure, let's say, and they have food insecurity, they screen positive for food insecurity. When they go home, they're going home with prepared healthy meals that they get. And what the data tell us is there's less likelihood for them to come back and be readmitted to the hospital. And all of the quality of life and their metabolic factors and the other things that we look at all get better. So when you realize that we have really hard data that shows that if we give people healthy food, they'll get better. The other thing that I think we want to talk a little bit about is COVID. So COVID is not just your flu. I just wanted to put that out there. It is a very, very serious illness. And why some people get more complications with COVID than others, we don't actually know. But we do know that patients who have chronic diseases like obesity, like cardiovascular disease, have a bigger problem with COVID. Some of the obesity stuff is really fascinating because obesity is an inflammatory disease. And when you have an inflammatory disease and you have a disease like COVID, what's then going to happen is you have like what they call a cytokine storm. And basically you have all this inflammation that comes in, and the fat cells are just full of inflammation, and it just makes it worse. So what's happened with COVID is what people who have chronic diseases are already suffering more, then they get COVID, and then they're even going to have more problems with that. So we also know that people during COVID are losing their jobs, right? And then they having more increased need to have access to healthy foods. So COVID, to me, when I think about it from the health point of view, but I also think about it from the food insecurity point of view. I'm going to pause for a minute because I think, Laura, you're going to talk about some of the cool work we're doing in healthcare and the practices in the hospitals.
Yeah. Thank you so much for sharing, Tori. So at this point, you're probably all wondering, how is Good Shepherd addressing food insecurity in light of COVID? And I know Kristen just went over some details about how the food bank is addressing the pandemic and the increase in need in our state in general. And in the next session, you'll have the opportunity to hear directly from some of our community-based partners. But for right now, I really want to focus on our healthcare partnerships program called the Community Health and Hunger Program, and talk about how our healthcare partners are addressing food insecurity and COVID at the same time. So for those of you that are unfamiliar with the program, our Community Health and Hunger Program works with healthcare organizations across the state of Maine to address food insecurity in clinical settings. So we work with healthcare professionals to train them on a food insecurity screening tool that helps them identify folks that are food insecure or at risk of being food insecure. And then we help to make sure that those patients that are food insecure are connected to our community-based food pantries, and we offer fresh, nutritious food for them to take home directly from their doctor's office. Right now, we have a little over 100 healthcare organizations that we're working with on this program, connecting patients to community-based food pantries and providing them with shelf-stable and fresh produce. In 2019, our healthcare partners distributed about 90,000 pounds of food and served about 4,000 patients with take-home groceries. In the first 6 months of 2020, our partners have distributed over 100,000 pounds of food and connected with over 4,500 patients. So the need is definitely increasing. And one piece of data that we request that our healthcare partners send to us is information around their screening rates. So we ask them to send us information around how many patients they're screening for food insecurity and how many patients are screening food insecure. This helps us determine their food insecurity rate at their actual practice, and then helps us determine the food insecurity rate in the community. And what we found was pre-COVID, the food insecurity rate, the average among all of our healthcare partners, hovered around 4 or 5%. So about 4 to 5% of the patients that our healthcare network was screening for food insecurity screened positive. In the last 6 months, from March until August, September, we've seen that almost double. So we've seen the average increase to 6, 7, 8, even 9 and 10% in some communities. This is most pronounced at our federally qualified healthcare centers and in rural communities. We also surveyed our healthcare partners about their experience with food insecurity programming in the middle of the pandemic. And over 40% of them said that they felt like there was an increased need in their patient population from March until September, and they felt like the need was only increasing as time goes by. We've also seen a big increase in the amount of food that our healthcare partners are distributing. So the first 2 months of 2020, our healthcare partners distributed about 11,000 pounds of food a month. In the last 6 months, they've distributed upwards of 15,000 pounds of food per month. And while the food insecurity rate is rising, one thing that we've seen a really dramatic increase in is the amount of patients that are in need of immediate assistance from their healthcare provider in terms of food. So we ask our healthcare providers to let us know how many patients that are food insecure are taking home food from their office, so we can determine the immediate need within that community. And when we looked at the data from 2019, we found that about 35% of patients that were food insecure from March to September in 2019 felt like they needed to take home food from their healthcare provider, and they accepted food from their office visit. During the same time period in 2020, so March through September 2020, that average went up to 70%. So we're seeing now 70, 80% of patients that are screening for food insecurity are in immediate need of food assistance and accepting food from their healthcare provider's office. This topped out in June at 97% of patients across our healthcare network were taking home food for their healthcare providers. So in response to the pandemic, our healthcare partners have developed a number of different innovative strategies to serve patients while also staying in line with all the new COVID protocols. So you may have experienced this in your own life, but nearly all of our healthcare partners moved immediately to telehealth visits in early spring, and now are just kind of starting to reopen for non-emergency visits. And this obviously had an impact on the way patients were connecting with their healthcare providers and the way that our healthcare partners were able to connect patients with food in their community. Fortunately, our network has proven to be amazingly resilient, and nearly all of our healthcare providers remained open and remained engaged with our food insecurity program throughout the spring and summer. And while patients were not able to physically access food at their healthcare offices, practices developed drive-through models. They would make appointments for folks to pick up food outside of their offices. They partnered with local food pantries to do community-wide distributions. A few of them offered home delivery services, partnering with community action programs or their paramedicine teams. So really just coming up with really innovative ways to make sure that the folks that were homebound or not able to come into the office were able to access the healthy food that they need. So I'll wrap that up for now. I know you guys probably have a lot of questions, but while you think, I want to show you a quick slideshow of some of our partners in action throughout the summer, and then we'll open it up for questions. Let me share my screen on them. So I'll stop sharing so you guys can pop in with questions, but.
You know, and as Laura was talking, one of the things when we first started doing this work in our healthcare practices, and I went to my colleagues and I said, so guys, we're going to start screening for food insecurity. And they're like, oh, Tori, really? And I'm like, yeah. And they're like, oh, the next thing you're going to want is you want food pantries in the hospital. I'm like, yep, that's exactly what I want. And you know what, the thing, I've done a lot of work with practices. This is one of the best things that the practices, they love to screen for things and then to be able to do something. So somebody screens positive and you can actually give them healthy food. I've never seen an uptake like this. I mean, Laura and I were working on, I said to Laura, we might get a couple practices, and then we got 10 and 15, and it was all over the state. It's just crazy. I just want to say that as a physician, we love the idea that we are in our practices promoting all this healthy food. So we'll pause here. We've got 5 minutes. Any questions for us or any comments or thoughts?
And just so folks know, you will have to unmute yourselves if you do have questions. My name is Georgia Jenkins. I also work here at Good Shepherd Food Bank. And I was just curious if Laura or Tori, if you'd like to talk a little bit more about the differences in food insecurity and the use of the programs in rural and urban areas.
Yeah, for sure. So there's, definitely a difference between working with a federally qualified health center in a community, like Bingham in northern Somerset, and working with, Maine Medical Center in Portland. What we found is that the food insecurity rates in rural areas tend to be a little bit higher, and the percentage of patients that are in immediate need, so that the percentage of patients that are taking home food from their healthcare provider's office tends to be higher than the state average of our network. But the referral rate, so the rate of which our healthcare providers are providing referrals to our food pantry network, is actually lower in rural areas, which makes sense because in rural areas you probably have less options to connect with, or you might already be connecting with the food pantry in your area and just not getting enough food. In urban areas, we see that flipped. So we see more referrals to our existing partner network and less need for emergency food at the offices.
Dr. Rogers, I work for a food bank in Augusta, and I guess I'd be interested for some advice. So on our regular distribution that we do, I want to say it's virtually all healthy items, shelf-stable items, etc. Every Thursday, we have a free surplus food Thursdays, where we wheel out everything left over from our retailers, etc. We're giving away a ton that used to just go to a cattle and a pig farmer. We still give some spoiled stuff away to them on Fridays, but we're still wheeling out pastries and soda, stuff that we don't typically give during distribution. What advice might you have for us? Because our contracts that we have with the retailers, we take everything that they give us.
So Bob, it's a great question. And I think, first of all, you're doing great work. So, and just realizing that if you're only doing that on one of the days, that's pretty amazing, because, maybe a while ago that would have been more often. I personally, there's two different views on it. Well, many different views. Some people feel like everybody needs a treat. And I agree. I like those treats and those danishes and those pastries. The problem is sometimes there's just too much of it and they're getting it in lots of different places. I think, and I'm happy to work with you on this. I think the more that we can really get the message out that we don't want to say those are bad foods. I don't want to say they're bad foods. I just want to say that I want more of the healthy foods. And then if people can, if they're going to take some of the food, and we've done this too, is take small amounts of it. So if there is a lot of danishes, then maybe somebody would take a small amount of those danishes. But it's hard, we, in the schools that we work in, we really try to make sure the healthy choice is there, because if you give a kid a Danish and an apple, it's going to be hard for them to take the apple. But if it's an apple and a banana, there you go, right? So it's a tough one. But I would say that, I think one of the things that I'm working on, and I know Good Shepherd is sort of figuring out how do we change some of these policies so that you're not put in that position.
Thanks.
The other thing I say that I know that when I've talked to folks in the local food pantries and their connection to the healthcare practices, that this connection has never occurred before. And our healthcare teams love to know the people like Bob. They love to know who's out there and what are they doing and how do they help. And I think there's more of these kind of direct referrals that we'd like to be making. So we're excited about that. And I'm very excited about many of the hospitals throughout Maine are really actively looking at having food pantries in their hospitals that would that would, you know, help supplement and augment what's already out there, and being able to offer at different hours, different times. And so I think there's opportunities for all of us to sort of come together. And if in the Portland area, if we have a food pantry in our hospital, then we would be augmenting the times that the other food banks are open. And so that we could do that at different times. So I'm very excited to see finally healthcare is getting on board and helping. And I'm here to help any of the food banks, anything I can do. Any questions or other thoughts?
1 second.
1 second, okay.
I think it will, here we go. So here, we'll all be joined back into the main group in just a few seconds. See you all back there.